Now, how do I go to full screen? No. You showed me, right? I forgot. Oh, Shift 5? Okay. So let's, yes, you had a question? No. Do you know anyone that has Lyme disease? Mr. AV guy? Do you know anyone that has Lyme disease? No? Okay. Do you know anyone that has autism? No? Okay. Okay. In my experience so far, everybody knows somebody that has autism. So that's a first I've heard. Okay? It's good to hear. It's good. All right. So I like to call, I like to look at the neuroendoimmune system when I treat, right? So some of the signs of adrenal fatigue. The adrenal glands in the body are important because they participate in healing. They help you recover from stress, from any kind of an illness that you might have, right? So adrenal glands. So what are some of the signs that you can look for in your patient for adrenal fatigue? I mean, neurological we saw, right? Then we are looking at the endocrine system, and immune system also we will learn how to treat. So signs of adrenal fatigue. You feel tired for no reason. You have trouble getting up in the morning. You wake up tired. I have patients that come to me and say, oh, I sleep for 10 hours, but I'm still tired when I wake up. I don't know why I'm still tired when I wake up. Then you're constantly feeling overwhelmed. Oh my God, how am I going to get through the day today? So that's and then you have difficulty recovering from even a common cold. It takes 2 weeks to get over a cold. Many people crave salt and sweet, and sometimes the cycle is reversed. This is what energy medicine practitioners call as switching. It's called as switching. You have your energetic switching that happens, and you feel more awake and alert after 6 p.m. So this is the adrenals are reversed, okay? That's pretty much your adrenal insufficiency. You know, one thing that I've seen that endocrinologists will do is look at thyroid very easily. Not too many look at adrenals, right? Then when they look at thyroid, they only measure the TSH. Oh my gosh, TSH is low. So you have hypo, so we have to give you medication. They do levothyroxine, they do Synthroid, right? It's very important to know that anytime you are overstimulating your thyroid, you need to treat your adrenals. Otherwise, your adrenals will crash further. So what happens? These patients, they get medication for thyroid and they're still tired. So what happens? The doctor will increase the medication, but they are still tired. So ultimately, your hypothyroid starts generating thyroid antibodies. And some of them end up with thyroid nodules and cancer as well. So it's very interesting. This is such common knowledge that thyroid and adrenals should always be treated together. If anything, adrenals should be treated first. Okay. Now, before I proceed from the adrenals, what I wanted to do was, I'm going to take one question just to, break up the complexity. Anybody has any questions? You do, yes. Can you speak louder?
Yes. The first question is for adrenal, so we have to check just cortisol or is any other blood test?
Okay. Okay. So the question was, for adrenals, do we need to check just cortisol or anything else? So the answer to that is to look at adrenal fatigue. One has to look at cortisol, ACTH, ADH, osmolality, and DHEA.
And for cortisol, is it just morning or morning and evening?
Okay. The question was for cortisol, is it just morning or morning and evening? Just one reading is sufficient as long as you know, right? Because unless you want to do a saliva test, right? Saliva cortisol can be done, throughout the day. You can see, but honestly, if your doctor knows how to treat adrenal insufficiency, just one simple blood test is enough. And you need to be aware of where you are in your menstrual cycle, if it's a woman. So that is part of that assessment as well. Oh, anytime, yes, yeah. It's important to be aware where you are in your cycle while doing adrenal. There is no restriction that if you are in the middle of your cycle that you cannot do a blood test. No, we can do blood tests anytime. It's just a factor to ask your patient that where you are in your menstrual cycle at that time. The question is, right, right. Okay. What are the physical signs, or are there any physical signs that you can see on a patient with adrenal insufficiency? So, other than a good history, I don't really see any physical signs. I mean, if a patient comes in looking tired, having dark circles under the eyes or bags under the eyes, sometimes there will be those liver spots on the face, brown spots on the skin. That I'll see sometimes, which gives me a clue. I also do a pupillary test to see how the pupils respond. And that is a specific test which, when I do physician training workshops, that's when, we'll do demonstrations and whatnot. It's not for this seminar, but a pupillary test. We also look at the fingernails. We do a tongue diagnosis, right? We look at the tongue, and there is American herbalism and even Ayurvedic herbalism has a specific way of looking at, it's called as, tongue diagnosis and pulse diagnosis. So those are a few things that can be done to look at adrenal insufficiencies without running labs. And of course, you can always do muscle testing. That's important. Yeah. Long story. Yeah, that is more for a specific, physician training workshop. That is a good 2 hours in itself, looking at the eyes, the pupils, the tongue diagnosis, the pulse diagnosis, When I come next time, we'll do a good workshop, where we do hands-on, we'll do labs. We can do that as well.
Can you see what's happening
if your child has autoimmune encephalopathy, autoimmune encephalopathy is inflammation in the brain that often happens when you have PANS or PANDAS, and especially when there is autism. Autism, there is research that shows that there is an immune deficiency, right? So that is a sign of inflammation in the brain, right? That is the deer in the headlights look that kids with PANS and PANDAS get, especially when there is a flare. Now, if there is pupillary imbalance during other times when there is no flares, then that can signal some sort of an adrenal issue going on. It's hard to determine without examining the patient, like what is the issue going on. But yes, let me ask you this. Is your son, are you aware that, as a mother, that he is, you must have seen signs that he is very intelligent. You've seen signs that he is smart. He's been diagnosed with autism, but you've seen signs that there's something waiting to come out, that this child is very intelligent. He wants to interact, he wants to learn, and he's getting this strep and PANS and PANDAS issues, right? You have seen that, yeah. That is a classic sign. Yeah. Yeah. Yeah, so your son may very well have the treatable kind. He may have what I call as complex autism. Yeah. Yeah, these are some of the classic things that I hear from mothers, and that's what I went through. Remember I said, people said, oh, well, get over it, accept it, it's autism. What makes you think you're special? I said, well, I am special, and I'm going to prove it. So we did. It took years, but we are fully recovered. I've had at least, like in the last year alone, about 21 children that have been recovered from autism. And the others that are in treatment in my clinic are all improving. So, they may not have lost the diagnosis, but the 21 in the last few years are mainstreamed, are in regular classrooms, and in fact, one of them, Jake, really sweet, he came up to me and he's like, Dr. Jody. I'm like, yes, Jake. He held my face like this. He says, thank you. I'm able to make friends again. So, these are the moments that a physician always remembers. So Jake is fine. He needs a little bit of resource room in school, but he's doing well. He's mainstreamed almost every day. Almost the whole time, except for like one period of math, little bit of help he still needs. But that is still the borreliosis resolving itself. But yeah, he's lost the diagnosis. Yeah. Many stories like that. Okay, shall we proceed? I know it's a lot to take in, so I like to break it up. Okay, let's talk about the brain stem. Okay. Again, if you remember, the theme was looking at the endocrine system also, right? Neuro, endo, immune. So the toxins, the microbial, endo, and exotoxins have been shown to affect the hypothalamus pituitary, the pineal gland, the limbic system, and the medulla. Okay, so when you're looking for hypothalamic and pituitary control to see if that has been lost, especially in patients that are complicated with mold exposure, Okay. You have Lyme disease, co-infections, mold. So especially for those patients, it is important to measure all of these